Mark was a healthy young man in his early 20s. He was fit, active, and always careful about his health. One morning he woke up with an unusual tingling sensation around his lips. As the day progressed, the tingling turned into itching, and a small, painful blister appeared. Concerned, Mark searched his symptoms online and came across a worrying possibility: herpes simplex virus. Mark had always been cautious about his sexual health. He couldn't imagine how he could have contracted herpes. He decided to schedule an appointment with his doctor, Dr. Thompson. The thought of discussing something so personal made Mark uncomfortable. With a mix of anxiety and hope, Mark dialed Dr. Thompson's office and secured an appointment. The next day, Mark nervously sat in Dr. Thompson's office recounting his symptoms. "I found this blister on my lip a couple of days ago," he explained, "and it's been tingling and itching ever since. I looked it up online, and now I'm worried it might be herpes." Dr. Thompson, a kind and experienced physician, listened intently to Mark's concerns. He had seen countless patients like Mark, anxious and misinformed about a common virus. "Mark, I understand your concern. Herpes is a common virus, and it's important to remember that most people who have it don't even know it." Mark's eyebrows shot up in surprise. "Really? But I thought it was really contagious and everyone who had it would know." Dr. Thompson smiled gently. "That's a common misconception, Mark. While herpes can be transmitted through close contact, many people have it without ever experiencing any symptoms." Relieved that Dr. Thompson didn't seem judgmental or alarmed, Mark felt a wave of hope wash over him. Perhaps his fears were unfounded. Maybe it wasn't herpes after all. Still, he wanted to understand more about the virus and how it was transmitted. Dr. Thompson explained that herpes simplex virus, or HSV, is actually two closely related viruses, HSV1 and HSV2. HSV1 typically causes oral herpes, which is what you might have, Mark. It's spread through saliva, often through kissing or sharing utensils. Mark nodded, recalling a time he'd shared a drink with a friend who had a cold sore. He hadn't thought much of it at the time, assuming it was just a harmless cold sore. Dr. Thompson continued, HSV2, on the other hand, is usually sexually transmitted and causes genital herpes. Both types can lie dormant in the body and reactivate later, causing outbreaks. This information surprised Mark. He had always associated herpes with sexual activity, not realizing that something as simple as sharing a drink could spread the virus. It made him realize how easy it was to contract HSV without even knowing it. "But Dr. Thompson, I've been really careful. I haven't shared any utensils or kissed anyone recently." Dr. Thompson nodded understandingly. "That's good to hear, Mark, but remember, the virus can remain dormant for years. You could have contracted it a while back and are just now experiencing symptoms." This explanation made sense to Mark. It was possible he had come into contact with the virus in the past without realizing it. He felt a surge of relief knowing that his recent cautiousness wasn't necessarily to blame for his current condition. Dr. Thompson went on to explain that HSV is a very common virus. In fact, he said, it's estimated that over half of the world's population has HSV1. And while there's no cure for herpes, the good news is that it's manageable with medication. This information surprised Mark. He had always thought of herpes as a relatively rare and serious condition. Learning that it was so widespread and manageable put his mind at ease. Dr. Thompson continued, "Once you have the virus, it stays in your body. However, it doesn't mean you'll have outbreaks all the time. So what causes outbreaks then?" Dr. Thompson explained that certain triggers could reactivate the virus, such as stress, illness, fatigue, or even sun exposure. "It's different for everyone," he said. "Some people have frequent outbreaks, while others may only have one or two in their lifetime." Mark was curious about the dormant nature of the virus. "So, if I have it, it's just been hiding in my body this whole time?" Dr. Thompson nodded. "That's right. Most of the time, the virus lies dormant in nerve cells and doesn't cause any problems." This knowledge gave Mark a strange sense of both fascination and unease. The idea of a virus silently residing within him was unsettling, yet he was grateful that it wasn't constantly causing problems. He wondered what it was about certain triggers that could awaken the virus. "Now let's talk about the symptoms you've been experiencing," Dr. Thompson said, bringing the focus back to Mark's situation. "You mentioned tingling and itching, followed by a blister. Those are all common symptoms of oral herpes." Mark described the blister on his lip in more detail, and Dr. Thompson listened patiently. "It sounds like a classic cold sore. Other symptoms can include pain, redness, and even flu-like symptoms in some cases. Flu-like symptoms? That sounds awful. Dr. Thompson reassured him. Don't worry, Mark. Flu-like symptoms are less common and usually only occur with the first outbreak. They're your body's way of fighting off the virus. This information calmed Mark's nerves. He hadn't experienced any flu-like symptoms, which hopefully meant he wasn't dealing with his first outbreak. He was glad he had come to see Dr. Thompson, who was patiently addressing all his concerns. Dr. Thompson went on to explain that while herpes is usually a manageable condition, there are some potential complications. In rare cases, the virus can spread to other parts of the body, like the eyes or brain. The brain? That sounds serious. Dr. Thompson nodded. It can be, but it's very rare. If you ever experience symptoms like confusion, seizures, or changes in vision, seek medical attention immediately. He also mentioned that people with weakened immune systems, such as those with HIV or undergoing chemotherapy, are more susceptible to complications. However, you're a healthy young man, so the chances of you experiencing any serious complications are extremely low. This information, while alarming at first, ultimately reassured Mark. He was grateful that Dr. Thompson was being upfront about the potential risks, while also emphasizing that they were unlikely in his case. Sensing Mark's lingering anxiety, Dr. Thompson offered words of comfort. Mark, I know this is a lot to take in, but I want you to know that herpes is incredibly common and usually not a major health concern. He explained that while there's a stigma associated with herpes, it's important to remember that it's just a virus. It doesn't define you. Millions of people live normal, healthy lives with herpes. Mark appreciated Dr. Thompson's compassionate approach. His words helped to alleviate some of the shame and fear that Mark had been harboring. It was reassuring to hear that herpes was nothing to be ashamed of, and that it didn't have to control his life. The most important thing is to manage the virus and take steps to prevent its transmission. With the right information and care, you can live a perfectly normal life. To confirm the diagnosis, Dr. Thompson recommended a simple blood test. The test will detect antibodies to the herpes virus, which will tell us for sure if you have it, he explained. Mark agreed to the test, eager to have a definitive answer. He felt a wave of gratitude towards Dr. Thompson for his thoroughness and for putting his mind at ease. The blood test was quick and relatively painless, and Mark left the clinic feeling more informed and empowered. Dr. Thompson assured Mark that he would call him with the results as soon as they were available. In the meantime, he encouraged Mark to reach out if he had any further questions or concerns. As he walked out of the clinic, Mark felt a sense of relief. While he still didn't know for sure if he had herpes, the uncertainty was no longer as daunting. He had a better understanding of the virus, its transmission, and its management. A few days later, Dr. Thompson called Mark with the results. Mark, the blood test came back positive for HSV1. This confirms that you do have the herpes simplex virus. Mark was initially taken aback, but he quickly remembered Dr. Thompson's reassuring words. I understand, he said calmly. Dr. Thompson continued. The good news is that there are effective antiviral medications that can help manage your symptoms and reduce the frequency and duration of outbreaks. He explained that these medications work by suppressing the virus's replication, preventing it from spreading and causing symptoms. They can be taken daily as a preventative measure or at the first sign of an outbreak, he said. In your case, Mark, since this seems to be your first outbreak and you haven't had any previous symptoms, we can start with a short course of antiviral medication to help clear up the cold sore and prevent future outbreaks. Dr. Thompson emphasized the importance of taking precautions to prevent transmitting the virus to others. Mark, even though HSV1 is common, it's crucial to be mindful of others. He advised Mark to avoid sharing personal items like utensils, lip balm, or razors. And of course, avoid kissing or any close contact while you have an active sore. Mark listened attentively, committed to taking responsibility for his health and preventing transmission. Dr. Thompson reassured him that by following these simple precautions, he could significantly reduce the risk of spreading the virus. Remember, Mark, knowledge is power. By understanding herpes and taking the necessary precautions, you can live a healthy and fulfilling life. As their conversation ended, Mark felt a sense of clarity and reassurance. While he had initially been afraid and uncertain, Dr. Thompson's patient explanations and compassionate demeanor had alleviated his fears and empowered him with knowledge. He realized that herpes, while a lifelong condition, was manageable and didn't have to define him or his life. Armed with information and a plan for management, Mark felt confident that he could navigate this new reality. He was grateful for Dr. Thompson's expertise and support, and he left the clinic feeling informed, reassured, and ready to move forward with his life. Mark knew that he could manage this condition and continue to live a happy and healthy life.